Making the decision to undergo plastic surgery is a big one. Finding the right surgeon, staff, and facility is paramount. Dr. Sergio Maggi of Austin Plastic Surgery Center is here to walk us through their very thorough process. Dr. Maggi, we begin with talking about goals and expectations with your patients, right?
Right. Well, before they become a patient, how does it develop? Let's talk about that. I think that's interesting to people. How do they get there? And there being that surgery day. The first thing is to do their research, figure out who to go see. There's different ways. I think majority of the people go online, or they start online because it's just convenient, especially nowadays with websites being so well designed and being so informative. It's almost like experiencing the practice. When it comes to our practice, many people look for photographs online. I don't have them. I've never had them. I started my practice in 2001. I decided that day I'm not doing pictures. I have pictures available when you come and see me. Why? Because I think the pictures are, one, designed for education, and if I just cherry pick my most beautiful results and said that's my work, that's an artifice. That's not giving the patient a proper understanding of the procedure, and I think that's the purpose of the pictures, because let's understand that these pictures are my patients. Yes. And these photographs belong to people who really would prefer not to have their body parts on the internet. So that was my sentiment 10, 12 years ago, and it's been confirmed because most of my patients say, thank you for not doing that, and I'm happy to have my pictures shown, but we do it in the consultation. As
a tool for you to explain what the process has been with a particular patient.
That's exactly. So the patients feel that they're being respected, and I'm honored that I can use their photographs because it's their property, their photographs, to explain to a potential patient, just like they were in that position before their surgery, to understand what is available and what types of goals can be achieved, because not everyone wants a Playboy bunny look. Right. They want a natural look, they want this, they don't want that. Well, that's the discussion. So that's the first step. You've figured out who to go see, you're in the consultation, you're asking questions, you're listening to what's available, you're meeting the surgeon at some point. And then at that point, the next step is the history and physical, because you decided to proceed with surgery, so now we have a more formal meeting. I meet with you at that time as well, and my nurse, and we review labs, we do a complete physical exam, we do all the photographs, all the measurements, and get you basically, it's a dry run of the surgery.
And you're triple checking before that patient goes into surgery.
Their paperwork and their lab work has been reviewed by myself, my registered nurse, and then my anesthesia provider.
So lots of eyes are going to see that.
Lots of eyes. So by the time we get to surgery, and it's always in that boutique environment that I have, because I have my own surgery center, accredited Quad ASF Surgery Center. So with all that, we have a private environment, but we have a very thorough environment. And with that, by the time you're in surgery, again, it's attention to what your goals and expectations, and everybody's there understanding what needs to be met. And the people that were in my history and physical, my nurse or my surgical assistant, is now in the operating room. So it's not just I remember what you need to achieve and delineate, it's the staff with me. So that's that consistency that I wouldn't have had if I was in a hospital setting. So that's why the closed environment of my staff in my own surgery center. At that point, it's the surgery. Fine. The surgery is to meet those goals, but that is not the result. I always say that at the end, when I speak to the family member on how the case went, and I say now she needs to heal, or he needs to heal, and get that end point. And again, it's attention to details.
Thank you so much, Dr. Maggi. We always enjoy talking to you. Appreciate you being here. And go to drmaggi.com to see the procedures they offer, to meet the team, or to book a consultation.